Caution. The content of this video presentation pertains only to the specific diagnosis of a sports concussion. If your athlete is experiencing worsening of symptoms such as increased headache, decreased consciousness and alertness, numbness in a part of the body, weakness or loss of muscle contraction in a part of the body, seizure, neck pain or stiffness, vision loss in one eye, confusion and irritability, please stop this video and call 911 or go directly to the closest emergency department. A concussion is a serious and complex brain injury that typically involves direct impact to the head or body. This causes a rapid acceleration, deceleration, or rotational injury to the brain inside of the skull. During this process, chemicals are released by the brain that result in stimulation of nerves, causing the signs and symptoms associated with a concussion. The injury involves a functional disturbance to the brain's normal activity, resulting in symptoms such as headache, nausea, vomiting, dizziness, abnormalities in balance, the ability to focus and concentrate, change in sleep habits, sensitivity to light and sound, and blurry vision. Concussions do not involve a structural injury to the brain. Therefore, imaging with CT and MRI will appear normal. In the past, a concussion was categorized using grading systems. Patients were treated based on the grade of their concussion at the initial presentation. Many of these grading systems involved loss of consciousness as a criteria. We now know that most concussions do not involve a loss of consciousness. Grading concussions resulted in treatment based on broad categories, resulting in improper management. Every concussion is unique and specific to that individual, and should be treated on an individual basis. Once an athlete is suspected of having a concussion either by parent, coach, and/or athletic trainer, they are removed from their sport or activity and are not permitted to return. A physician trained in the evaluation and management of sports concussions should then evaluate the athlete. This evaluation process has been recognized as a very important step in the diagnosis and management of a concussion. In Pennsylvania, a state law was signed into effect November 2011, which underscores the importance of recognition and proper evaluation and management of sports concussions. Coaches now have a responsibility to identify athletes who may be concussed, necessitating removal from sport, and ensuring proper management by a physician properly trained in the evaluation and management of a sports concussion. Concussion evaluation should be aggressive in evaluating symptoms and risk factors, and treating concussed athletes is performed on an individual basis. There are many different factors that may complicate or prolong an athlete's recovery, including age, gender, previous concussion history, seizure disorders, learning disabilities, ADHD, or a history of migraines. Proper evaluation of a sports concussion involves review of the mechanism of injury, physical exam, review of symptoms at the time of injury and as they change over time, and neuropsyche testing. One of the main goals in recognizing and treating a concussion is to prevent long-term adverse complications, such as post-concussive syndrome, second impact syndrome, and chronic traumatic encephalopathy. Returning an athlete back to sport before the brain is fully healed can lead to these complications. A repeat concussion occurring before recovery increases the risk for prolonged symptoms and potential long-term complications. Second impact syndrome is a rare but serious complication of repeated impacts to the brain without treatment. Because the brain is more vulnerable to injury after an initial brain injury, it only takes minimal force to cause irreversible damage. Appropriate sports concussion management should prevent second impact syndrome. Chronic traumatic encephalopathy is a progressive degenerative disease of the brain resulting from a repeat concussion without sufficient time to recover. The most common complication of a concussion is post-concussive syndrome, in which the patient experiences the signs and symptoms of a concussion for months or even years. Concussions take time to heal. Every concussion is unique, and one cannot predict how long it will take to recover from a concussion. As such, every athlete is treated on an individual basis.